Welcome back. March is Colorectal Cancer Awareness Month. It is the second leading cause of cancer-related deaths in the United States, but there is some good news. It is highly preventable with some early screening. Joining us now to talk about this is Dr. Lindsey Fish from Denver Health to help us understand why early screening is so critical. So let's get right to it because there's so much information here. Colorectal cancer cases are rising in younger adults. It's actually one of my big fears here because I feel like so many people in their 40s are starting to get colon cancer. Why did the screening age drop from 50 to 45?
Well, you just touched on it. It's because in the last 2 decades, we have seen an increase in colorectal cancer in people in their 40s. So in response to that, the United States Preventative Task Force did say that we need to start colorectal screening at the age of 45. It's critical because catching it early means we can cure it, and we have a much higher survival rate of 90%.
And many people think that colorectal cancer is primarily impacted for men, but that's not necessarily true. Why should women be just as proactive?
Yeah, so rates for colorectal cancer are the same for men and women. And so women also need to start screening at 45. Women frequently ignore symptoms because we attribute it to just stomach upset or things related to our menstrual cycle. But it's really critical that anybody gets screened at 45.
And I know it's not the most enjoyable process to have to get screened for colon cancer. And I think that people put it off because of that. And you also have to take a day off work and all of that. But there are multiple ways to be screened. So what are some of those options?
So you're referring to a colonoscopy,
yes,
which is obviously invasive, and the preparation cannot be enjoyable, and you do have to take time off work. The benefit, though, of a colonoscopy is that you can get treated if we see polyps or precancerous lesions right away during that procedure. And if everything looks good on a colonoscopy, you're set for 10 years. Now, if that's not something you want to do, we actually do offer stool tests where we can test the stool for signs of potential cancer. And those are done every year, so a little more frequently. But what matters is getting a screening. So pick one that works for you.
All right, that's all good to know because that you can go big or you can go little, at least you're getting tested. So what would you like to say to anyone who may be hesitant? Because again, no one wants to talk about the colon. It's kind of an embarrassing topic. So people don't want to talk about these things. Why is it important that we should do this and not be hesitant about it?
Early colorectal cancer has no symptoms. And so if you don't screen, you're not going to know. If we get a screening done, we can catch it, we can treat it, and you can go on with your life. It's really important.
Yes. And is it a fairly curable cancer if you catch it early?
It is a 90% survival rate.
And who is the highest at risk for colon cancer?
Our highest risk patients are someone who has a family history or someone in their family with colorectal cancer, or if you yourself have inflammatory bowel disease. Other risk factors include obesity, smoking, alcohol, and eating high processed meats a lot in your diet.
Okay. Well, Dr. Fish, thank you so much.
My pleasure.
An important topic and a good, timely for the month of March. So thank you so much. And we'll see you next week.
Sounds great. Thank you.